Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Well, we have brought back today a familiar voice as we speak about the latest COVID variant and vaccines. With over 43 years of experience in anatomic and clinical pathology, Dr. Edward Uthman has dedicated his career to physicians and patient care. He sits on the board of directors at Oak Bend Medical Center and serves on many committees, a former chief of staff, physician of the year, and sits on our COVID ad hoc meeting. He is the doctor that patients rarely see, but his department is one of the most important. Welcome back, Dr. Uthman.
Thanks. It's great to be back.
Well, we're in a time now where people are starting to get out there and feel comfortable. Some are getting vaccines, some are not. And now we're seeing these new strands coming up. And I noticed that in the hospital and in Fort Bend County, that we're seeing more COVID positives. Is this due to the Delta variant B1617.2 first detected in India?
Well, at our level in the lab, we don't actually check for the individual variants, but the health departments, both the state and the county health departments, do check for these things, and the CDC does monitor them. And it appears that there is an expansion. The expansion that we're seeing in the incidence right now is due to this Delta variant. And just a word on the terminology. So if you listen to or read about COVID before May 31st, they talked about B.1.1.7 and B. It sounded like alphabet soup or like a bingo game or something. So that was obviously causing a lot of confusion. So they changed the terminology. So we still have these in the lab. There still are those designations with the B dot and the P dot, this and that number, but they've given them letters of the Greek alphabet that's easier to remember. So the first variant that was detected was the one from Great Britain. That was B.1.1.7. That was eventually called the Alpha variant. So we've gone through that one and several others, and now we're to the Delta variant, which of course is the fourth letter in the Greek alphabet. I expect at some point we will run out of letters in the Greek alphabet because these mutations are going to keep on. But right now, the new variant that we're most concerned about and is most responsible for new cases is the Delta variant. Okay. So yes, I do think that the increase in positivity we're seeing at the hospital is due to expansion of the Delta variant.
Okay, so at least we're not seeing as many positives come through as we did initially. Do you think that's due to people being vaccinated?
Yes, and also I think that many people are still avoiding unnecessary contact. I still see people in the grocery store in Fort Bend County wearing masks. Not everybody, but lots, especially older people like me. So I think that there are still some of those methods that we used before we had the vaccine. I think that's probably kept it down. You know, I gave an interview 2 weeks ago, and I was all full of optimism and forward thinking. But now, just in 2 weeks, we've seen a little bit of a turnaround. So now my optimism is tempered a little bit because I'm concerned that people relaxing their social distancing and mask wearing and this stubborn number of people that won't get the vaccine and the increased infectivity of the Delta variant, it makes me concerned we may be going into yet another surge. Now, we can't say for sure yet, but in a few weeks, we'll know.
So, Dr. Uthman, you were the one that convinced me to do the vaccine. Your words and stuff, because I have a trust level with you. But you go on TV and you hear masks aren't effective. Masks are effective. Vaccines aren't effective. Vaccines are going to give you 3 heads and extra toes. There's all this information out there, and no one knows where to go to get the right information. And my hope with you today is that you can help us decide. I do believe masks work just from what I've seen in the hospital and how nurses and doctors did not contact COVID. And that was because of mask wearing and stuff. What is your take on the masks and the effectiveness of it?
Well, I'd say that there are two. First of all, I don't know for sure that it's just mask wearing that does what it does. But if you look at what we did, which was mask wearing and social distancing, some combination of those two things, it's no doubt in my mind that they reduce the spread of respiratory viruses like COVID. Now, the way we know that without doubt is that as soon as we started doing it in March of 2020, the flu season, and influenza is another respiratory virus that's spread very similarly to COVID. So the flu season just ended prematurely then. Then in the Southern Hemisphere, which of course our summer is their winter, the Southern Hemisphere did not have a flu season. And then when we got around to our winter of 2021, we didn't have a flu season. So I think I'm kind of frustrated that nobody ever seems to bring that up. But to me, that's incontrovertible evidence. There's no way you can argue that what we did not demolish the flu season. And then anecdotally, and I've asked friends about this, so since you've been socially distancing and wearing masks, how many colds have you had? Very few people have had colds. And a lot of us are getting kind of used to not having colds, and we kind of enjoy that. I mean, it's not just that it prevents COVID, but it's preventing colds, which are not fatal, but can be very annoying and uncomfortable. So I think that there's no doubt that the mask wearing / social distancing was effective to a certain extent. Now, the vaccine would make all that unnecessary. And it is unnecessary for people that are vaccinated. Because of the holdouts on the vaccination, we continue to see the disease popping back up again and possibly going into another surge.
So the vaccine definitely helps prevent the COVID infection, but it doesn't mean you won't get COVID, correct?
Yes. Well, first of all, I'll say, as far as I can tell, since vaccines became available, none of the inpatients at Oak Bend admitted for COVID were vaccinated. So we don't keep a specific record of that, but I've polled the main physicians that take care of COVID patients individually. None of them can remember having admitted a vaccinated patient to the hospital. Now, you can definitely get COVID, and you can spread it to others, but it's very unlikely you'll get seriously ill enough with it to be admitted, much less die. That said, yes, when you get down to the very fine numbers, people that have been fully vaccinated, some have been hospitalized with COVID and a few have died. That's still very, very rare. In fact, it's so rare that it's not something that enters into my worldview. It's, that's like worrying about being struck by lightning in your bedroom. It's just not something that I worry about or I advise other people to worry about.
In a report on July 6, only 41.6% of Texas, 29 million people, have been fully vaccinated. Why do you think that is? And do you think it's because of all the good and bad information out there? I mean, you would think it would be more.
Yes, I mean, there's definitely there's a geographic difference. And there is definitely a political difference. And again, this is incontrovertible. It's not a matter of opinion. If you take the 2016 electoral map, where they paint the states blue and red, and then if you flip that back and forth with a similar map, where you take a threshold of 70% of adults having one dose of the vaccine, paint the ones that have that blue, and paint the states where they don't have that level red, it's almost exactly the same map as the 2016 electoral map, with two exceptions. In 2016, Nevada voted blue, but right now they're red vaccine-wise, and Pennsylvania is the opposite. but I just don't see that there's any way to escape that the effect of political leadership in some states and in some jurisdictions has reduced what should be a much higher level of vaccine acceptance. Now, that said, there's always been a hardcore anti-vax group that've been around for a long time, and you can actually date them back to the 19th century. But I think that's a small number. There's also a group that distrusts the healthcare system in general. And we see many people in the Black community who call attention to the Tuskegee Experiment, which was a horrendous, I can't even call it an experiment, a stupid project, started, I believe, in the 1930s and not discontinued in 1973, where they treated Black men, or they diagnosed syphilis in Black men and treated half of them and did not treat the other half. So even after effective treatment was established for syphilis, they still didn't treat them. And that's is a true story, and it's widely circulated in the Black community. And some may still remember that and not trust the system. So that's part of it too, that really has nothing to do with political leadership today. That's a historical reason. But I think it's the political leadership and the mixed messages that we got, especially at the national level, and now from media, that has caused this, what I consider a disaster in public health. I mean, some of us are old enough to remember when polio was still around. There was no, I mean, if you liked Ike or, if you didn't like Ike, you got your kid's polio shot. I mean, this is crazy. When did this ever become a political thing? But it definitely is now. There's no way around it.
And you hear so many concerns that the vaccines haven't been thoroughly tested or may cause long-term problems. And I'll tell you, that was a fear for me too, because I heard all the bad things that could happen. And you kind of put that in perspective for me. And I'd like you to do that again for our audience.
What are the long-term effects of vaccines? First of all, how do we know anything about vaccines? If you look at so I date the age of science-based medicine back to the mid-1800s. Before that, it was pretty much worthless or more harmful. But you can go back even further. You can go back, I believe it's to 1796 for the first vaccinations. That was for smallpox. So I consider vaccinations the longest, the science-based medical modality that we have the most experience with, by far, way longer than anything else. And this issue of long-term effects, that's just not something you see with vaccines. So there's no reason to believe in these long-term effects. Here's long-term effects that we definitely know you have to believe in because they exist, and that's the long-term effects of COVID infection. So we're talking about non-existent long-term effects for which there's no theoretical basis even of vaccines versus the definite long-term effects of COVID. And again, it's an easy decision. And again, I challenge people, and I've even talked to some people with science degrees. They say, what about the long-term effects? I said, well, let's walk through that. Let's talk about the process of vaccination and how the immune system works, and tell me by what theoretical mechanism you could have long-term effects from this. Nobody's ever been able to answer that question, citing anything scientifically. So it's the decision of the risk of something that either has a short-term effect that's extremely rare, versus an infectious agent that does the same thing the vaccine does, plus adds all these other viral antigens, plus adds viruses that actively replicate and destroy your cells. Again, I don't see what the problem is in terms of making a decision between those two scenarios.
I've heard a lot of people say COVID wasn't really real. It was formulated, and I guess us that are in the hospital a lot have seen the real effects of COVID, and seen the after effects of COVID. And I want you to confirm that COVID is real, and it is deadly. And
well, yes, and again, it's not anything new. We've known about coronaviruses, and we've known about for a long time. And we've known about fatal coronaviruses at least since the early 2000s, when we had the first SARS epidemic. That was the SARS-1. And we've had infections by similar viruses since that were fatal. And if it was something that people were making up, how do you account for it being worldwide when you see reports from countries that aren't even friendly with each other all saying the same thing? China, India, Europe, South America, North America, they're all seeing the same thing. Now, they've seen it at different times, but by the time the disease does get there, they see the same thing. Unless you can somehow, I guess if you believe in a conspiracy of hundreds of countries or 150 countries or however many it's been reported in, that all their health department people are in some sort of conspiracy, I guess. But if you believe that, I mean, you'll believe anything. You have no sense of critical thinking or filter at all. Yeah, but yes, obviously this is a different infection from what we normally see and the influenza that we normally see. We have a much higher hospitalization rate and a much higher death rate than we see in influenza.
So there are 3 different vaccines out there right now. Is one better than the other, or is a vaccine a vaccine? I personally took the Johnson & Johnson, and I did just fine.
Yeah, I think the 3 that are approved in the United States, I would just get the one that's easiest for me. I got the Pfizer because that was the first one that was offered to healthcare workers. So I got that. But if the J&J had been the first one, I would have gotten that. Now, the question is, we're going to have a booster. Pfizer has announced that they think maybe we'll need one, but apparently they got together with government regulators, and there's not yet a recommendation for a booster. But again, this is one of the things we'll see in the future. And if it is determined that you'll need a booster, or if we need to get vaccinated every year to cover all these different variants, we'll find that out. Because obviously there are a lot of people working on this now. It's a high priority in the public health circles. So I'm not the least bit worried about the response of drug companies or regulators. I'm just worried about the acceptance at the grassroots level. If anything keeps this vaccination program from wiping out this disease, it's going to be that.
So what would you say to those that are reluctant or scared? Because I do believe fear is a big factor in this. We've heard, side effects and all these horror stories, but those are 1 out of millions. How do we put this in perspective and give our listeners a comfort in moving forward with the vaccine?
Well, I think that fear is an adaptive response, and we can all benefit from a healthy sense of fear. But you have to keep it in perspective. So on what basis do you fear a vaccine more than you fear a demonstrably fatal infection? And not only is it fatal, but if you survive it, it may be at the cost of weeks or even months in the hospital, permanently damaged lungs that require transplantation, and other more vague disabilities that may affect the nervous system. So we know all those things exist. I would say you need to fear that more. You need to fear that more than you fear the vaccine. And you need to, what I like to say is go with your gut, but follow up with your brain. So a lot of times you make a snap decision, you go with what seems right at the time. That's going with your gut. But that's only when you don't have enough time to think it out. But then you need to think it out and decide if you need to take corrective action on that initial decision. So that's what I think people should be motivated by: fear and hope and all these other emotions that people experience, but they have to back it up with their intellect. And that's what I'm not seeing them doing.
There are some people that have said, well, I've been around COVID. I never caught COVID. I'm not worried about it. It's no big deal. But it's like playing roulette in my mind.
I mean, when somebody says that, I'm thinking, what perfect, famous last words.
Exactly.
I mean, I can't believe people say stuff like that because it's like setting themselves up to get sick.
Right.
How could it possibly happen to me? I don't know. I don't get it.
So we're also hearing, we've seen some hospitals mandate vaccines, and now we're hearing the government talking about mandating it and all kinds of things. What's your opinion on this?
Obviously, healthcare facilities should mandate their employees be vaccinated, just as they have been for influenza. And some hospitals make you take even more than that. But all hospitals I know of, all the employees have to have the influenza vaccine. And so this is disease that's worse, that's probably more transmissible than influenza and has a higher death rate than influenza. So obviously everybody should be vaccinated that works in a hospital. So first of all, I want to publicly congratulate the Methodist system that endured all sorts of crazy pushback, including legal action and mass resignation of employees, because they did the right thing. They did the right thing for their community. They did the right thing for the Houston area. And the rest of us definitely need to follow their example. And these need to be mandatory in healthcare facilities. Now, the question is, should the government make you do it? Well, I guess this gets down to a really deep philosophical consideration. The rights of the individual versus the collective rights of the population. That's a spectrum, and people are going to come down at different points on it. I guess I'm sort of halfway there. I respect the right to body autonomy, but I also respect my freedom of speech to call people out on making what I think are unwise and harmful decisions and selfish decisions. So yeah, if you want to come up with some cockamamie reason to not get vaccinated, don't get vaccinated, but you're going to hear from me. Now, I'm not going to make you do it. I don't want the government to make you do it, but I definitely have an opinion about it. And I hope other people that are informed make opinions more apparent too in public.
Yeah, one of the things, and like I said, you convinced me to do it, and it was mostly out of fear. I had to think about the people I was around also, my loved ones and everything else. Because, yeah, I may not get it, but I could certainly pass it on to someone else. And I would have to live with that. And I was not pro-vaccine, but after getting it, the amount of peace you get with getting the vaccine and knowing that you have a little bit of coverage there is worth a lot. Dr. Uthman, is there anything else you'd like to tell us? Because we'd like to see 100% of people vaccinated.
I would too. And well, first of all, let's talk about, I think you mentioned early in the interview, people don't know who to believe. So just let me give you some tips on that. Okay, the politicians have made a mess of this, so just ignore them. But even in every state of the union, as far as I know, at least the ones I've looked into, the people that are working at the mid-level, like the policy people in the health departments, in the state health departments, in the county health departments, they are dedicated professionals. They make decisions based on science. They look at evidence and they draw conclusions from evidence. So you go to your health department website, they're going to tell you the right stuff. Now, sometimes they get politically influenced. There's a case we've seen recently in Tennessee. There was a health department official that was fired because she publicized the truth, which was that teenagers in Tennessee could get vaccinated without parental consent. And that is correct. That is legal and has been decided by the Tennessee State Supreme Court. But she was fired just by pointing that out. So there is influence from politics, but the people at the mid-level, they're solid. The CDC, they made some missteps. They perhaps didn't have as good a crystal ball as some other people had early on. But the people that work there are the best in the world, and they know what they're doing. And if you read the CDC website, it's hard to go wrong with them. So CDC and your local and state health departments, and just ignore cable news. I mean, either side. I mean, don't listen to Fox News or MSNBC or Newsmax or CNN. Just go to the health department people They don't have an agenda other than to keep you well. That's all they care about.
So you brought up the teenagers and stuff. Now we're talking about vaccinating our children, 12 and up, and maybe even younger, and getting back into schools. I had talked to our neonatologist in a past podcast, and he said he has no problem with it. What is your take on vaccinating children? Because, we were told children weren't as acceptable to it.
Right. So the question obviously originally was, are the children, even though they rarely get really sick with it, they can still get the infection and pass it on. So then the next thing I heard was, it doesn't appear that they're a significant reservoir. But then I keep seeing things like just recently, an article that came out of Oklahoma on the CDC website. There was a big cluster of COVID cases, which was the Delta variant, that apparently started in a gymnastics training facility. And those, of course, those are all going to be kids or, teenagers at least. So, and they infected a bunch of their relatives in their households. And I think a couple of those had to be hospitalized, one of which required intensive care. So children can get the disease. They can transmit it to people who are more vulnerable. And it really just comes down to the nuts and bolts gumshoes work of determining that it's safe and effective for kids. And they're in the process of doing that. I suspect eventually we'll see the vaccine approved for most age groups, including children. But it's just a matter of time. And again, you don't want to jump the gun. You don't want to declare a vaccine safe, even though you think it's probably going to be. But until you actually look at it in test populations, you don't want to say for sure. So that's where I am on that.
Okay. And then one more thing. We're going to get it all out for Dr. Uthman today. You're seeing a lot of the kids wearing masks all day in school and everything else, and it's harmful to their health, and it breeds bacteria and all of that stuff. It seems to be the next controversial thing. What are your feelings on that?
Well, again, it's like reinventing the wheel, because we have people that work in hospitals and in ORs for double shifts all their life. And now all of a sudden masks are harmful. Where did that come from? Now, when you actually start looking at it, you'll find some articles about it. The most recent one was in JAMA Pediatrics, which is a respectable journal. Somehow an insane article got through their editorial board, and it said that the levels of carbon dioxide in the mask are at toxic levels, basically. It turns out when you look into it, the person that wrote the article had already is from Eastern Europe, I believe. He had already had his relationship with his university canceled by the university. And he had no qualifications at all in toxicology. In fact, he wasn't even an MD or a PhD. He was a clinical psychologist. So here's a clinical psychologist, somehow gets an article in JAMA Pediatrics that was full of methodological errors and was immediately debunked by the medical community. So bad things get through. And that's why we have peer review. And hopefully peer review picks up these bad papers before they ever get published. But sometimes, it doesn't happen until afterwards. And of course, the more memorable example of that was Andrew Wakefield's article that said that the MMR vaccine caused autism, which was immediately and persistently debunked, but still people are carrying around that message. So yeah, the journals are good and we love peer review, but not 100%.
So you got to kind of do your research with reputable people. So I think in wrapping this up, the vaccine is more effective than dealing with the aftermath of COVID from a fact-finding method. We should go to CDC for our information and ask people that truly know the right answers and have the education to answer those answers, but without going out to the politicians and everything else, because they're politicians. We need to go to our doctors and talk to them. And masks are effective. And I would encourage everybody to go out and get their vaccine. What about you, Dr. Uthman?
Yes, everybody should get the vaccine except for rare exceptions that your doctor can determine. And if you're not vaccinated, you should continue wearing your mask and practicing social distancing. So it's the two very simple things, and you'll probably be okay.
We have on our podcast series a place to ask questions or make comments. I would ask, if you have questions, we will find you the answers that you need to make the right decisions for you. If you have comments, we're not interested in the political part of things or anything like that. We want this to be a positive thing to help people make good decisions for their health. And that's what we're here for. I'm sure Dr. Uthman, as I volunteer him to help me with the answers, will be glad to do so. But this is about us getting you what you need. As much as we love our community, we don't like to see them on ventilators or anything else in the hospital for something we could have prevented. Thank you, Dr. Uthman, for joining us today. And a big thank you to our listeners. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Again, if you have any questions, please email us. And if you need a vaccine, please go to our website. We are doing them for our greater community and would love to assist you in any way we can. Thank you, and we'll talk to you next time.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.